Hey guys, this is Dr. Akiba Green. I'm here to talk to you about real weight loss for real people. We're going to talk really about the problem that we're dealing with in our country. Obesity today in the U.S. has reached epidemic proportions. Over 65% of Americans are overweight or obese. Obesity packs many negative health effects. It increases heart disease. It increases type 2 diabetes. It increases hypertension. There's an increase in certain cancers associated with weight. Decreased sexual activity. Decreased quality of life and longevity. Lower self-esteem, lower self-confidence, and even rapid spinal and postural degeneration. You must understand that if you're carrying extra weight, these processes are happening in your body. The most dangerous thought that you could have is it won't happen to me. Right now is the time for you to decide what you want for the rest of your life to look like. If the average lifespan is 74 years, and you're in your mid-30s, mid-40s, how many weeks left do you have to live? How do you want to live those weeks? One of the things that we look at with weight is BMI. If your BMI is not where it needs to be, I sincerely hope that you'll make the decision to take action. When we talk about BMI, it's body mass index, it's actually a pretty good indicator of health. If we calculate our own BMI, the key thing is you want that number to be low. What we're seeing is this epidemic proportion of it getting higher and higher and higher. Now, are you ready to change? The answer to this question could literally change your life. If so, remember this, nothing in your life will ever change until you change. The only way to change is to truly make the decision to change. Making a true decision means deciding to achieve a result and completely cutting yourself off from any other possibility. That's a quote from Tony Robbins. And again, we're talking about what you can do, what you have to do to make those changes in your life. My office has certain goals for you. Number one, we need to do the appropriate testing to determine the root cause of your weight problem. You're not gaining weight, you're not overweight because of exercise alone, because of diet alone, because you're not taking a diet pill. We need to run tests to determine why you're overweight. We need to employ the correct approach for each individual in order to create the fastest, most permanent weight loss possible. I want to return you to the optimal state of health, and I want to have a maximum positive impact on your life. Really, my key for you, my biggest goal that we have, we're here to reinvent your life. You have this struggle that you've been dealing with. I see patients all the time. If we look around the patients that are at my weight loss workshops, they've been struggling for year in and year out. You come around to January, they go to another workshop trying to find another system, another plan. How do I lose weight finally? I'm here to give you that exit strategy. What can you do to finally make a difference that will stick, that'll actually get you where you want to be with your health goals for the rest of your life? Now, why are you here? You're not just here because you want to lose weight. You're here because you're unhealthy. You're on my website trying to find information. You're watching this DVD trying to find information because you need to get healthier. You're worried about your health and it's on the wrong track. I have certain ground rules if I'm going to take you on as a patient. You must truly want to lose weight. You must be willing to change your life. If you keep doing what you've always done, you'll keep getting what you've always gotten. Now, there's some basic principles of weight loss I want you to understand, and there's a lot of misconceptions that are out there. Calories are actually insignificant compared to fat burning and fat storing hormones. You have to be healthy before you can lose weight. You have to heal your glands, heal your hormones to keep the weight off. Fat burning and fat storing hormones have their own triggers. We call these metabolic drivers. Now, there are certain fat burning hormones I want you to be familiar with. Growth hormone, insulin-like growth factor, glucagon, adrenaline, thyroid hormones T3 and T4, testosterone. There are also some fat storing hormones we want to be familiar with. The big banana, the big one, is insulin. Estrogen is another one. Cortisol is another one. Now, there are metabolic drivers. There are things that cause these hormones to shift either into fat burning or fat storing. One of those big drivers is the adrenal gland. It's two little glands that sit on top of your kidneys. They're your stress hormone. And that stress response in an acute situation is going to cause an increase in cortisol to fight the stress, and then it's going to calm down. In a chronic stress situation, which many of you are dealing with year in and year out, what happens is cortisol goes up, it causes insulin to go up, and it causes fat to go up. The thyroid is another huge one. 90% of hypothyroidism is the result of autoimmune causes. So even if you're on thyroid medication, most likely nothing is being done to fix the reason why your thyroid got damaged in the first place. If you have a weight problem, your thyroid has to be looked at. We can't just look at your thyroid using the basic tests that your doctors do. Doctors run the bare minimum tests, and when you run the bare minimum tests, what do you get? The bare minimum results. Part of the reason they run those bare minimum tests is because that's what they feel insurance is going to cover. I can tell you, insurance will cover a lot more than a lot of doctors will order, but they don't order those tests because they're afraid that they don't have a treatment to help based on the outcomes of those tests. Now, with thyroid, we have to look at all the tests. It's not just TSH and T4. It's T3, it's free T3, T3 uptake, reverse T3, and how about thyroid antibodies? I told you 90% of low thyroid function, hypothyroidism, is a result of autoimmune causes. If you have that autoimmune disease, we have to look for it in antibodies. Now, the thyroid controls everything in your body. One of the big areas that actually helps with thyroid function, and goodness, it helps with hormone function, it helps with it helps with detoxification, helps with weight loss. It's your liver. Now, your liver converts 60% of T4 to T3, those thyroid hormones. It helps utilize and convert hormones from estrogen to testosterone. It helps eliminate excess estrogen in your body. It helps detoxify and get rid of waste in your body. It's incredibly vital and important, and it's part of our gastrointestinal tract. When's the last time you went to your doctor because of your weight loss and they looked at your colon, your gut, or your stomach to see if it was causing your weight loss? Probably never. The reason for that is they ignore these key metabolic drivers that are contributing to your hormones shifting out of position, out onto the wrong track. Now, we have to look at usually a couple common causes of gut problems. Food sensitivities. Are you eating wheat? Are you eating whole wheat thinking you're doing the best? Great quote just last week from a TV personality we all know. Whole wheat is just like eating white wheat that's got some preservatives and little additives added to it. It's really not that nutritious. But more importantly, in our country, up to 60% of Americans have some sort of a sensitivity to gluten, whether it's from mild all the way up to celiac. Gluten in our country is a real issue. I can tell you, the majority of my patients who have a gluten sensitivity, how do we know? We test them using labs. These patients lose weight when they give up wheat alone. Now, sometimes it's not just the wheat, though. Sometimes it's dairy, or coffee, or corn, or even soy or egg, or rice or potato. There's a whole bunch of foods. I look at 27 different foods that are commonly associated with autoimmune disease, thyroid dysfunction, metabolic dysfunction, and weight gain. One other area we have to look at is infections. Again, if your gut is a problem, you could have a hidden bacterial infection, a parasite, reflux. People who have reflux symptoms most likely do not have too much acid production. In fact, running a lab test will show that they most likely have too little acid production. What's refluxing is not the acid. It's actually the food that you can't digest. Leaky gut syndrome is something we have to look for. Infections, leaky gut syndrome, stomach acid, food sensitivities. If we're not looking at these 4 areas for your gut, then you're not getting your liver, gut, and metabolic drivers checked out properly. The last area we have to look at, your hormones, your sex hormones specifically. So when your adrenals are stressed, they kind of lose the ability to produce cortisol over time. What happens is your body is going to steal a hormone from your ovaries or your testes. It's going to steal estrogen. It's going to steal progesterone. It's going to shift it into something called DHEA, and it's going to try to make more cortisol with it. The problem that so many people have is your body tries to steal from Peter to pay Paul. The problem is Paul has a gambling problem, and you're not making enough hormones even when you get more hormone fuel over to produce them. So you end up losing the adrenal production, and you lose the female hormone production. And what happens is testosterone drops, estrogen goes up, progesterone drops, you gain weight, you get all these menopausal or menstrual cycle problems, PCOS, polycystic ovarian syndrome, #1 cause of infertility. All these problems develop because you're gaining weight and your body is shifted and not working right. One or more of these metabolic components is causing your weight problem. We have to do the right testing to determine what's driving it. Now, this is how it works. We must identify your metabolic drivers. This is actually pretty easy to do. There are tests that we run. There's a case history. There's forms that we fill out that I have you do. And then we identify your hormone problems. It's also easy to do. There's a test that we do to use that. I use a salivary hormone test to look at what your body's producing, not what's been stored. Even if you're on hormone replacement therapy, even if you're on one of those anti-aging creams, the pellets, the estrogen, testosterone, progesterone combination that you see some of these clinics do. They're going to say, rub it here, rub it on your legs. The problem with that is it just goes into fat cells, and your hormones never get used, and so your body shuts down the ability to make its own, and then you develop that resistance that leads to increased insulin, that leads to increased weight. Now, after we figured out your metabolic drivers and hormone patterns, I can design custom-made weight loss plans specifically for you. Once I do, you'll see weight falling off so fast it will make your head spin. I can tell you, in my office, I see the vast majority of patients lose significant weight, anywhere from 15 to 30 pounds in the first 2 months. Some patients see weight coming off quicker than that. Some patients, there is that 10-15% where, they only lose 5 pounds in the first month, 2 pounds in the first month because of what's changing. But I can tell you, over 90% of my patients see significant weight loss when they follow through with their system and they get their body corrected properly. Now, the healing process, your body must be approached both neurologically and metabolically. It's the only way it heals from anything. Only a healthy body can lose weight and keep it off. An unhealthy body will lose weight, gain weight, lose, gain, lose, gain. It's just a vicious cycle. So what's next? You need to make an appointment. You're on my website learning all sorts of great information. You see that we offer free workshops, usually once or twice a month, depending on when you're looking at this video. If it's in the fall, middle of the summer, I may not have a workshop tomorrow. It may not be for a few weeks. So my workshops are also posted online. You can look at them right on this page. You can watch the whole workshop. Once you watch that workshop, you decide if you like what you see, I want you to make an appointment. When you come in, we're going to do a full examination, a full evaluation. Bring shorts or loose-fitting pants and a t-shirt, if you will, to make our life easier for us to do the examination. I need to get your hands and feet to do the exam properly. You need to bring all the paperwork, fill it out completely, at least 2 days before your evaluation. I want to be able to review your chart. I want to look at any labs you've had done before we meet. And I want your spouse at the report of findings. We need them to know what we found wrong with you, and we need them to understand how we're going to fix you. I thank you for watching this brief introductory video on our weight loss program. I hope you've learned a little something. Like I said, my goal was to reinvent your life. Hopefully I've done that. Hopefully you'll be taking the next step to actually do something about your weight loss, about your metabolic health, and improve it from this point forward. This exit strategy requires you to fill out that little form right next to you to request an appointment, to get more information, to watch my DVD, and to actually improve your health. And I look forward to the opportunity to working with you to accomplish your health core goals. Thank you very much for watching this video, and take care.